everyone. I'm Mary Lee Kiernan, President and CEO of YWCA Greenwich, and welcome to the 2020 Virtual Old Bags Luncheon. We are enormously grateful for your support of our free domestic abuse services. You know, the measure of a community is how we serve and support and lift up and advocate for the most vulnerable among us and those most at risk. Domestic violence continues to be the #1 violent crime in our community. It is a widespread public health, social, and criminal issue that thrives in the dark, in private spaces, and in isolation. With the COVID-19 pandemic, victims and their children are more isolated than ever before as they quarantine with abusers. The trauma is now escalating, and since mid-March, we have been providing 3 to 4 times the number of services for each of our clients than we did a year ago. Proceeds from the Old Bags Luncheon account for almost a third of the annual revenue needed to deliver our many critical services for free, from shelter to the hotline to legal services. So your participation this year is so important and so much appreciated. As you navigate through this site, you will see that we have retained many of the aspects of our live event. As always, a highlight of the luncheon is our speaker. And this year, we've assembled a panel for a powerful discussion of domestic violence today. We have also over 150 fabulous silent auction bags, our premium bags with video descriptions by our wonderful auctioneer, Scott Mitchell, our program with donor listings and information about domestic abuse, and our Purple Purse Challenge paddle raise. I'm so grateful to our event co-chairs, Gretchen Belo, Connie Ann Harris, Lauren Walsh, and Judith Wertheimer for pivoting so quickly and creatively to ensure that this event could continue and be successful. And we are thankful for our sponsors, both individual and corporate, our bag donors from all over the community, and lastly, the founders of this event 15 years ago, Deborah Royce and Christina Vanderlyn. Now more than ever before, victims of domestic violence need our help, and we must continue the services that we have been consistently providing even through this crisis. Your purchase of a bag or your donation to our Purple Purse Challenge will help save a life. So please be generous, and thank you for your support. Now let me turn it over to our panel for their discussion.
Thank you, Mary Lee. I'm Connie Ann Harris, board member, YWCA Greenwich, and this year I'm really proud to be one of the co-chairs of the Old Bags Luncheon. We wish we could all be together at Bellhaven, but this year our auction is going to be virtual. As always, the bags are fabulous, but it has never really been about the bags. It has always been about raising awareness about domestic abuse, fundraising for our much needed services, and most importantly, saving lives. Although these days are tragic and trying, our commitment has never been stronger. So now I'd like to introduce my good friend and co-chair, Lauren Walsh.
Hello, I'm Lauren Walsh, board member of the YWCA Greenwich and co-chair of the Old Bags Luncheon. I'm so glad to be having this conversation today about the realities of domestic violence in our community. We are very fortunate here in Greenwich to have the domestic abuse services at the YWCA. Here with us now are a few of the professional staff of domestic abuse services to help us understand more about this widespread issue.
Hi everyone, I'm Mary Gold, Director of Domestic Abuse Services. I've been at YWCA Greenwich since 2006, and we are so grateful for the support we've enjoyed from our community for so many years. Thank you.
Hi, I'm Leslie Coplin, Prevention and Outreach Coordinator. My main focus is to raise awareness and educate the community about abusive relationships and also about healthy ones. Our education team delivers prevention education programs throughout Greenwich with youth, as well as trainings for professionals such as medical providers, lawyers, and therapists, so that they know how to handle domestic violence if it comes up with their patients and their clients.
Hi, I am Louisa Daly, and I'm a clinical supervisor and also an adult counselor at the Domestic Abuse Services. I've been delivering direct services at the YWCA to victims of domestic violence for 15 years. Domestic violence is quite complex. It can be hard to understand the true impact of abuse on survivors.
Leslie, can you help us understand more about the dynamics of domestic abuse and how so many victims wind up staying in violent relationships? Why don't they just get out? Why don't they just leave?
Well, this is probably the question that we get asked the most. And first, I want to say that many do or try to leave their abusive relationships. We know that shelters across the state are generally running at or above capacity. We also know that leaving is a process. So perhaps a survivor is thinking, when I have X amount of dollars saved in the bank, I'll leave. Or when the kids are grown and out of the house and it's safer to do so. We also know that there are financial, psychological, and social dependencies on the abuser as a result of being isolated from family, friends, and other support systems. We also know that there's a very real risk of separation violence. So even if there's been a relationship where there hasn't been any physical abuse present, it could ramp up once the victim initiates a separation. We've heard of clients whose partners have made continuous threats over the year. If you ever leave, I'll hurt our pets, or I'll hurt our children. And that alone is a really powerful reason to stay in a relationship, to protect those that you love. Finally, we know that there's no guarantee that leaving a relationship will actually make things better. Sadly, sometimes it makes it worse, even if just for a time. We know that the most dangerous time for a victim is when they make any initiation of separation, because the abuser is losing the hallmark of abusive behaviors, which are power and control.
Yeah, Leslie, thanks for that. I'd love to add on just a few more things that I see as a counselor that are compelling reasons that women end up staying in relationships that are very unhealthy for a time. You know, often, and women and men, I should say, because we see both at the Y, about 10 or 15% of our clients are actually men. So often they really love their partner, right? They love the good parts of him or her. And we always say at the agency, no one falls in love with an abuser. They show a different side when you're first getting into a relationship. It could be very charming, sweep you off your feet, and maybe they don't realize it's abuse for a long time. People are often surprised when they come to us to see that what they've been living with is abuse. Often victims or survivors believe it's their fault or partly their fault. I have a client right now who lives in Greenwich. She's a professional woman, very well educated, been married for over 20 years to a man who puts her down constantly, insults and berates her, cheats on her, sometimes with prostitutes. They have children together, and shortly after they got married, she left her job to provide, help manage the kids and their family. They lived abroad. She recently relayed all this to her psychiatrist, who said, well, you have to look at your role in all of this. You've been enabling him, so you're partly responsible, and kind of putting that back on her as if she already didn't feel enough guilt. So I think that's a big problem, is that sometimes people that are supposed to be helping can reinforce that guilt that people already feel. Clients start to believe the perception of what he says is true, that they're stupid, they're incapable, undesirable. Often we hear that abusers will say, no one else would ever want you. And they believe that. It's like you hear the tape running in your head. It's awfully hard to turn it off or even turn the volume down. And finally, they don't want to tear the family apart. They don't want their kids to turn against them, to blame them, which sadly often or sometimes ends up happening. I had another client years ago, one of my first clients, who had 2 young girls, and she worked so hard to protect them from a violent parent. And then once the divorce happened, he was successful at turning her older daughter against her, and she didn't really have any relationship with her older daughter for all of her high school years. She did begin to reconnect in college, but that was a huge loss. So these are all very real fears and real reasons to stay.
I would add to that, domestic violence victim, abuser, these are really difficult words and labels to think about and to identify with. And so it's really hard for people to see themselves as a victim of violence or domestic violence, and to see their partner as an abuser, thinking that this could never happen to somebody like me. And it's really important to acknowledge that this is an issue that does not discriminate. It cuts across all racial lines, ethnic lines, socioeconomic status, education level. And sometimes it's hard for people to still understand that this is such a significant issue in our community of a town like Greenwich. But it is. And we work with victims and survivors from every neighborhood in our community. And actually, it can be even harder for somebody who's achieved success in other areas of their life, professional success, financial success, to come forward for help and acknowledge that they've been a victim.
Wow, that is so complicated. It's hard to imagine choosing to stay in a relationship, but it sounds like the risks of leaving could be worse. So with that, given the pandemic and shutdown of normal life has been very difficult for all of us. Can you tell us why this might be an especially challenging time, maybe even more dangerous for victims of domestic abuse? What are you and the staff doing that's different now?
Well, as you said, Lauren, this has been unprecedented times for all of us. And we've had to very quickly adapt the way that we are providing services, reaching victims and survivors. And I'm tremendously proud of the way that our organization and our team has been able to do that, to continue to be fully operational and supporting people who need our help through our hotline, our emergency shelter, individual and group counseling through video conferencing, even reaching children through these means has been really important. Many of our clients right now are facing escalated violence. People are really isolated during this crisis. They're literally trapped at home with their abuser. Generally, during times of stress and anxiety, this could be a time of escalated violence for all of us. It's certainly not a cause of domestic abuse, but for a situation that was violent before or abusive, now with this added stress and anxiety, tensions could be running even higher. Including that is financial strain. With the economic situation right now, people are very afraid and concerned. Many have lost their jobs. We know that unemployment of an abuser is a very high risk factor for escalated violence, even lethality and homicide. So another concern is also that kids are home. The schools are closed. Children are now witnessing and exposed to more violence than perhaps they were before. We know that all children are impacted by violence in the home to some degree, even if parents think that their kids don't really know what's going on. We know that children are impacted, but now there's no respite for victims, and there's no respite for children who now also are disconnected for supports and safeguards that they may have had at school, with friends, coaches, other activities. So we're really concerned about the situation our clients are in now. And as they're managing all of these new challenges, distance learning, trying to keep safe, organizing what's going on at home, even possibly caring for somebody who's ill. So at the same time that these risks are increasing, there have also been new barriers that have come up for victims during this time. It's more difficult to access services. They're literally trapped at home. The victims now are terrified, as they usually are, of the consequences of their abuser finding out if they were reaching out for help, and at the same time are even more desperate for our support. Other barriers are safeguards that were in place and more easily accessible before this pandemic, such as legal protections at court and even medical care, are still available, but more difficult to access. So for somebody who may have gone to seek medical treatment for an injury due to domestic violence may not be doing so for fear of being exposed to the virus. And that contact with a medical provider could have also been a safeguard. We've seen a huge increase also in the amount of support that victims are seeking. For example, a client who may have been coming in once a week for counseling and emotional support is now engaging in that service through video conferencing, and then also calling our hotline in crisis several other times through the week. Victims are also seeking our support to gain basic needs like food and housing and clothing. People are really having a hard time right now, and this is just adding to the underlying stress and tension in a violent relationship.
Thanks, Meredith. I'd love to just add a couple of the actual quotes and stories that we're hearing from clients on our hotline and in our counseling, our remote counseling sessions. We had a client who said her abuser threatened to deliberately infect her with the virus if she didn't behave the way he wanted to. Another client who was forced to wash her hands over and over again to the point of her skin cracking and bleeding. Another client stated her abuser accused her of putting him and the kids at risk if she simply took a walk, which was like her only break from just being inside all the time and being around his abuse. And finally, a client who was denied access to healthcare, when she was feeling symptoms of the virus coming on. So as Meredith said, our clients being trapped inside is really the worst possible scenario for them, as abusers often try to isolate clients anyway as part of their abuse. So now it's really like a perfect storm as everyone's trapped inside and not allowed out, and not allowed with being at home with someone else who's home all day. And as Meredith said, economic tensions being stronger and making, tensions hotter in the home as well. So not only are they stuck at home, but they're not able to get out and do the things that help them take care of themselves, like seeing a friend, taking a walk, going to work, or volunteer, whatever they have in their life. They're not able to do that. It makes me think of a client of mine who lives in Coscob, and her only break from the ongoing berating and abuse that she gets at home is to walk into town and go to a local coffee shop in the morning. She can't do that right now. So instead, she's been calling our hotline from her car, or calling for a counseling session, or perhaps when she's taking a walk in the Pine Needham, if she's allowed, out to do one of those two things. So clients are going to have to be more creative in these times to get away from their abuser.
Louisa, none of us know what life is going to look like when we eventually get out of the crisis. What do you anticipate are some of the long-term ramifications of the pandemic for victims and those who are unfortunately in intimate partner or experiencing intimate partner violence?
Yeah, that's a great question, Connie Ann, because we're just expecting for the floodgates to be open when all this ends. Living in a state of ongoing stress and danger, fearing for your physical or emotional safety, is really in the Oxford Dictionary's definition of trauma is a domestic abuse situation. That's one of the examples. So it's really, as I said before, kind of a perfect storm. And many of our clients have told us that emotional abuse, the daily put downs, insults, belittling, hostility, is much more damaging to them than actual physical violence. They have no bruises to show for it. And they're being gaslighted and told that it's all in their head, that they're crazy, it's not really happening. And this happening over time is very damaging. Prolonged exposure to this kind of stress, this PTSD, post-traumatic stress disorder, takes some time to heal and takes some special attention, to work through. Also, health challenges for people living in a situation, not just mental health, but physical health challenges. When you're living with stress over the long term, the cortisol and other neurochemicals that are released during your trauma response can cause over time gastrointestinal issues, cardiovascular challenges, immunocompromised challenges, so their physical health problems as well. How to heal from this. We spend a lot of time helping clients understand that trauma is stored in their body, and we do a lot of work with helping them learn how to quiet their nervous system using breath, the great tool that we all have with us and forget to use. some simple chair yoga stretches to heal and release tension and anxiety, some guided meditations, mindfulness. By the way, some of these exercises are up on our website right now if anyone's interested. So we're trying to reach people, with our healing techniques during this time, and I'm sure we'll be doing a lot more of it after all this is over.
And I think as an agency, we can really anticipate an influx of new clients once they feel safe to do so, and finally can make that all important initial contact with us through the hotline, or leave the house to access services. They'll feel more comfortable moving around once they're not afraid of contracting the virus. We also know that with courts opening up again, victims can more easily access legal protections like restraining orders, and we know divorce proceedings will resume. So there will be that potential for that escalating separation violence that I spoke of earlier. If I file a restraining order or serve divorce papers to my abusive partner, I'm notifying them that they're losing that power and control over me. So we want to be prepared for that.
Meredith, I know that the DAS at YWCA Greenwich has been supporting the community since 1981. And thinking back before the pandemic crisis, what were your major areas of concern? What kept you up at night? And what do you think are the fundamental issues that are being overshadowed right now because of the crisis for these victims?
Right. So, as you said, we are concerned and fear for victims of domestic violence every day. Certainly, this crisis and pandemic has created new concerns and fears and challenges. But one of the stories that really gripped us this year was the tragic case of Jennifer Dulos, who was our neighbor in New Canaan. And this story really brought the issue of domestic violence into the spotlight, not just locally, but nationally. And it brought the community together in a way that I'd not seen before around this issue of domestic abuse. People, I think, really could relate to Jennifer's story and her life here in Fairfield County. And they, for the first time, realized that, wow, this serious issue of domestic violence is happening in my neighborhood with a friend, and I may not even know about it. And certainly, one of the issues that we have always paid attention to, but really we're focusing on this year, is the broken system of family court in Connecticut, something certainly that Jennifer Dulos had battled with here in Connecticut, and as so many of the clients that we work with are as well. This year, we were really looking forward to advocating for new legislation that was going to be introduced in Connecticut to try to reform the way that domestic violence and custody and divorce issues are handled in family court. Now that will have to be on hold as well.
We also know that the pandemic has really overshadowed the importance of the prevention work that we do. We know it's so critical for us to be out in the community and connecting, particularly with youth. As presenters in the classroom, we're also another pair of eyes and ears, talking about important life skills and concerns about social and emotional health. We become trusted adults for these students, and they can connect with us if they're concerned about their own relationships, a relationship of a friend, or even about something that's going on at home. And we're teaching those all important warning signs for abusive relationships and skills to have healthy ones. One of the most compelling stories from the work that we do in the community education team was a presentation we had done for an 8th grade class. At the end of each cycle, we give a chapstick that has our hotline number on it to the 8th grade student. And a few weeks later, we had an adult client walk in, place the chapstick on the desk of her counselor, and say, "I'm here because my daughter gave me this chapstick and said, 'Mommy, these people can help us. I think you should go talk to them.'" So we know we're really having an impact on the community, and we're just not able to do that right now.
Okay, so given all the concerns we've discussed today, what can you do to help? I've heard about universal codes or signs victims can give that they need help when they can't communicate in front of their abuser.
Yeah, I've heard about those too, and they sound good on the one hand, but on the other hand, I think if it's a little unrealistic to think that, you know, the person watching is going to know automatically what that means, unless we all really learn these methods. The other reason they can be dangerous is that if someone does understand that someone's asking for help, they themselves may not have the proper training to know how to help. And they might do something that puts the survivor in more danger than they're already in, like showing up their house or sending an email or even a voicemail that they don't realize the abuser's checking all this. So I really think the most helpful thing anyone can do for someone that you suspect is in a difficult or dangerous relationship is to connect them with a domestic violence agency, either ours or one of the 17 others in the state of Connecticut. That's where, you know, we all have the training to know how to create that important safety plan, which is the first thing we do with all of our clients, even as early as on the hotline, is start to talk about how to stay as safe as possible, whether you're ready to leave yet or not. And so we make these very tailor-made safety plans that are specific to a client's circumstances. And if someone doesn't want to come in, they're not ready to call us yet, because it's a process, you know, you as a friend or a family member can come in. You're always welcome to get information, education. We can hand you a packet of information to share with the person you're concerned about. So I think that's the best place to start.
Right, and we also know that we can raise our collective awareness around the dynamics of domestic violence, kind of like we're doing here today, having this conversation, and through the Old Bags Lunch, we're really shining a light on an issue that thrives in darkness. On a more granular level, especially during this time of social isolation, as individuals, we can be sure to keep in touch with our friends, our neighbors, or our coworkers. Really stay connected to anyone you suspect might be experiencing domestic violence in the home, just to let them know that they're not alone.
Yeah, I would say for sure, if there's someone in your life that you're concerned about, or even might just have a hunch that something's going on, try not to judge them. It's really difficult to put ourselves in someone else's shoes, and we may not understand the choices that they're making or the decisions that they have to face. But most important is, please don't turn your back on someone that you are concerned about. You can let them know, if it's safe to do so, that this is an issue that impacts many, many people. The latest statistic is 1 in 3 women will experience domestic violence at some point during her lifetime. So this is not an isolated incident that happens to just some people. Encourage them to call our hotline. You can even call in together on a conference call. And as we look forward to reopening our doors, come into our building, to our YWCA, with somebody that you're worried about. Encourage them to come in. And I really want to emphasize that reaching out for help, calling the hotline, coming in for services, doesn't mean that you have to leave right away. It doesn't mean that there has to be a major emergency in that moment. All it means is that you're ready to talk, to learn, and understand what options are available, how to stay safe as possible. And so please don't wait. If you are even questioning that your relationship is controlling or abusive or just unhealthy, please give us a call, and we're here to talk things through.
Thank you, Meredith. Thank you, Leslie. Thank you, Louisa, and everyone on your team at DAS for all that you do. You're a safe haven and a life-saving resource, and we cannot thank you enough. And, you know, although we're all speaking from our homes, we're actually this year more empowered than ever before to save lives, to protect these children, and to keep all of the services, which, by the way, are all free and anonymous at the YWCA DAS. So please make a donation, buy a bag. It's going to be the best bag you ever bought, no matter what shape or size or what it looks like, because that bag is going to save a life. So thanks everyone for this discussion, and thank you for all of your support and your generosity.
Thank you.